Hello, everybody. Welcome here with our first video, first podcast for the current topics class. Today, we're going to talk about one of the most popular type of injuries in the world of sports in general. So, we're going to talk about ACL injuries and particularly about the non-contact ACL injuries. Um, just to give some introduction of this type of injury, um, the ACL rupture occurs without a direct trauma or any contact, but through landing or change of directions and decelerations. Um, this kind of um this kind of injury, to give you some numbers, it is estimated that the society could save one more than $1 billion annually. So this is a huge amount of money. If the risk of ACL tears were halved, so just give you some the idea of the impact that the prevention of these kind of injuries could have on the world of sport. So um, we're gonna start identifying some risk factors for this type of injuries, and we have to divide them in the modifiable and the non-modifiable. So the non-modifiable are given by the sex, the age, um, the anatomy and genetics, as well as the ligament laxity of each athlete, while the modifiable factors that emerge from the studies are, first of all, an improper landing mechanics correlated with a poor core strength and some deficits in neuromuscular control as well as some muscle imbalances. So, frequently described injury mechanism involves landing with minimal hip and knee flexion, often resulting in a valgus knee position, internal tibial rotation, and pronated foot. So, as we can see in the picture, for example, um, this posture significantly elevates strain on the ACL. Um, so, for this reason, um, the purpose of the article was to give an overview on the preventive solutions that we can find to this problem. So, universal training program is what fits best this kind of issues, and in the detail, this kind of training is gonna hit hamstrings and quadriceps. So um, the essential components involve plyometrics, strength training, and neuromuscular education. So this program must comprehensively understand and address these biomechanical and neuromuscular deficits, since contact injuries are often unavoidable and strategies predominantly target non-contact injuries. So it is crucial to strengthen core and glute muscle for pelvic stability, as well as hamstring strengthening. And this is very so much indicated to counterbalance anterior tibial displacement and improve the ratio between hamstrings and quadriceps strength. So many studies suggest that the targeted neuromuscular training programs can significantly reduce the incidence of non-contact ACL injuries. They can reach the 80% of reduction. So these trainings successfully modifies kinetic and kinematic profiles in athletes, and leads to safer movement patterns. So there are some criteria for rehab, and we can divide the process in three stages. An early stage where focus will gonna be is gonna be um, on reduce pain and swelling, control them via cryotherapy, compression, and restoration of full range of motion, particularly achieving full extensions. And we must immediately address quadriceps atrophy and atherogenic muscle inhibition. So techniques as neuromuscular electrical stimulation, so NMES, blood flow restriction training, and early isometric exercise are used to make it easier. And in the mid stage, the main goal is going to be to restore knee extensor strength to target a deficit of no more than 20% compared to the healthy limb. And we're going to use exercise combined um, like open kinetic chains and closed kinetic chain exercises with OKC exercise introduced gradually at low loads and specific angles. While in the late stage, um, this focuses more on optimizing muscle strength, neuromuscular control, and movement quality, and it culminates in sport-specific exercises. The exercises are introduced to restore also the explosive strengths, um, like ballistic exercises, jumping, and purifying neuromuscular performance. And restoring proper movement quality is fundamental, as poor quality is strongly associated with an increased risk of ipsilateral and contralateral re-injury. So the ACL itself has a significant proprioceptive role which must be re-educated, and the return to sport must be criterion based, as we said. So despite meticulous rehab, only about 20% of professional athletes return to their pre-injury level, and the risk of secondary injury remains high, ranging between 50% and 30%. So, in conclusion, the only effective cure is rehab, and effective prevention requires the implementation of tailored programs focusing on proprioception, neuromuscular coordination, and biomechanical corrections. And the rehabilitation must be criterion based, addressing pain, range of movement, progressive muscle strengthening, and neuromuscular re-education to restore function and mitigate re-injury risk. The evidence strongly suggests that an integrated approach combining prevention and meticulous rehabilitation is essential for optimal outcomes in affected populations. And some future research must continue to explore innovative and personalized strategies to further reduce non-contact ACL injuries incidence and improve recovery outcomes. So the question is, should we uh, focus on developing strong athletes or to develop smart ways of training? Thank you so much. This is the article, the reference for the article, and see you next week.